Hi everyone, my name is Aldo Flores. I'm your nurse student for today. This is the procedure for the intradermal injection for skin test. Okay, first we need to introduce myself and my patient, which is I'm going to explain why it is necessary and what I'm going to do to the patient. The next is I'm going to provide privacy, and I always prepare proper hand hygiene to prevent cross-contamination. And also, I'm going to read the doctor's order to secure for the information of my patient. And also, I'm going to prepare all the equipment what we needed. So the next is we need to prepare the medication from the vial or the ampoule withdrawal. So first we need to prepare all the equipments and apply clean gloves. Apply clean gloves is prevent cross contamination with my patient and infection also, because we use for the procedures skin test. So I'm doing this wearing gloves. So I'm going to introduce myself in my patient. So hi sir, my name is Aldo Flores. I'm your student for nurse for today. So I'm going to administering you the intradermal injection for skin test. Okay. The next procedure is we need to um, aspirate the needles, the needles in the sterile water. So we need to prepare one aspiration needle for the getting the sterile water from the ampule. This is the sterile water, and this is the um, aspiration needle, and this is the syringe of 1 cc. And for this is the for example, this is the vaccines or the antibacterial medicine. So this procedures, this is a skin test is to verify allergies for my patient and to know if he had allergy in the medication when we insert in this skin test. So this is reflected to the skin test for the injection or the um, skin test. Okay. So we need to aspirate, also open the syringe. Open the syringe. So this one. And open up. And check the air bubbles. So you need to dilute. And so for during this aspiration or dilation, it is 0.9 for the sterile water and 0.1 for the medication. and put again the stereo in the syringe. The next procedure is we need to um, um, clean the surrounding of the skin of the patient, which is using cotton balls and alcohol. This is the procedure for circulation. So inject. So you need to check the bevel, which is the syringe of if okay. So before the you need to do this is um um touch the skin of of the patient by using like this. And you need to bevel up. Wait. So you need to place the bevel up for the skin test. So this is the injection for the skin test. And so we need to um, um, wipe the excess damage or excess slightly or gentle. It's like this. If you can see, the skin test for the patient is glow up and just like this. So this is the intradermal injection for skin test. So before you use skin test, you need to check the bleeding, inflammation, because if the patient having an inflammation, you never use skin test for the skin, just like in case. And if the patient having a bleeding in this, just like in the after you skin test, you need to prepare cotton balls to wipe the excess damage for the skin test in this procedure. So for and besides, we need to prepare the medication. Prepare the medication if the patient having a allergy. So for example, I have an antibacterial. So we need to assume this, just in this procedure, I need to assume that I inject some 0.1 cc in the skin test for this procedure. So if for example, if the skin test for the sterile water is 0.9, for the medications or the antibacterial uh, or the antibacteria is 0.1 cc. Okay, so it is completed for the 1.0 cc. So, so the next procedure is we need to discard all the materials that just like cotton balls when you use in this skip procedure, or the syringe, the aspiration needle, and also all the materials what we use in this procedure. So the next is I'm going to um, dispose these gloves and document all the information about this, and also I'm going to um, to do again the proper hand hygiene. So again, my name is Abel Flores. I'm your nurse student for today. So I'm from FEMA, Pamagnas, Minnesota, Marikina. Mabuhay.